Certainly. So before I arrived at our cancer center, they had embarked on an effort to improve breast care in our community. And years ago, there was no coordinated breast cancer care for women in our community. And so they would play the game that we call patient pong, where a woman would go see someone for an imaging, a mastectomy, maybe they got a biopsy, then they saw the breast surgeon, then the breast surgeon would send them to the medical oncologist, the medical oncologist would send them to the radiation oncologist, then they might go back for additional testing or imaging, and they would go back and forth like a pinball or a ping pong ball. And again, they would be sort of like playing patient pong, and there would be delays in treatment, there would be duplication of tests, and it was very stressful on the patient. And delays in treatment can sometimes cause poorer outcomes. So it was a bad construct. With the creation of a dedicated and coordinated breast center centered around a breast surgeon and a navigator, a nurse navigator who coordinates all the care, and a multidisciplinary clinic where a newly diagnosed breast cancer patient was seen by the surgeon, medical oncologist, radiation oncologist, and the navigator, and then even bringing in additional services like social work for psychosocial support, nutrition if needed. All of those things came together, and then on top of that, the creation of a tumor board where when a patient was seen on the Friday multidisciplinary clinic, that patient would be discussed yet one more time on Tuesday with everybody, the entire community of cancer care providers, and in addition the radiologist and the pathologist to discuss the biopsy. And so that all-encompassing coordinated wraparound care meant that the patient got a unified coordinated solution and care plan for their cancer. So what happened? So the time from diagnosis to treatment was markedly reduced. It went from weeks and weeks to like under 21 days, sometimes as short as 7 days. It improved patient satisfaction. It de-stressed things for patients and for their caregivers and their family. And it reduced the cost of care because of duplication of services. So at the end of the day, it was a win-win-win all around. And for our program, what it did was it made us the leader in breast cancer care in our community and ultimately allowed us to capture probably 90 to 95% of the breast cancer care in our community because we were providing the best care. And for our patients, an additional benefit was that previously they often had to leave the community to get care, and now they can stay in their community surrounded by their support system, their loved ones, their family, and it's a better situation for them as well.